Benign prostatic hyperplasia refers to non-cancerous enlargement of the prostate gland, which results in obstruction of the urine flow from the bladder. So, benign prostatic hyperplasia is one of the commonest causes of male urinary symptoms. In the average age at which lower urinary tract symptoms related to benign prostatic hyperplasia occurs is about 50 years. So, men may seek treatment for lower urinary tract symptoms either because the symptoms are bothersome, or they feel that it may lead to acute urinary retention, or out of fear that it may be an indication of prostate cancer. So this is important to establish what the patient wants from the consultation. Some patients, once we are sure that the likelihood of the urinary retention and prostate cancer is low, they may not wish treatment for the symptoms. Currently available medicines can either relax prostatic smooth muscles or cause reduction in the prostate size, and therefore ease the symptoms of benign prostatic hyperplasia. A combination of available medicines, especially in patients with a prostate size more than 40 milliliters, produce better responses than monotherapy. Benign prostatic hyperplasia may lead to complications such as recurrent urinary tract infection, acute urine retention with painful distension of the bladder, chronic urine retention with painless gross distension of the bladder, hematuria and renal failure. So the main causes increase in the number of prostatic cells due to stimulation of testosterone. The symptoms: lower urinary tract symptoms, previously referred to as prostatism, and also hesitancy, that's delaying in initiation of urination, poor weak urinary stream, and straining, terminal dribbling, sensation of incomplete bladder emptying, urinary incontinence, that's overflow or bedwetting, and frequent passage of urine, especially at night, as nocturia, and urgency and urge incontinence. So the signs that are usually elicited are enlarged prostate gland on rectal examination, tender palpable bladder, acute urinary retention, non-tender palpable bladder, that's chronic retention, uremic signs, for example, drowsiness, confusion, also palpable kidneys in hydronephrosis. Investigations: serum creatinine, prostate specific antigen to exclude prostate cancer, urine for culture sensitivity, abdominal and pelvic ultrasound to exclude hydronephrosis if serum creatinine is elevated. So the main treatment objectives are to exclude prostate cancer and reassure patients accordingly, to relieve symptoms and prevent development of complications, to identify and treat any associated complications. Non-pharmacological treatment program of monitoring and watchful waiting through regular checkups for mild symptoms. There's a urethral catheterization for acute retention of urine, and suprapubic cystoscopy if urethral catheterization fails. Also, suprapubic needle puncture and aspirational drainage of urine to partially decompress the bladder and relieve pain, as when suprapubic cystostomy is delayed. So pharmacological treatment: so patients with bothersome symptoms and prostate size less than 40 milliliters, that's small prostate, first line treatment, you give terrazozine oral, 2 to 10 milligrams at night. To start with 2 milligrams at night, you double dose at weekly intervals, a maximum of 10 milligrams, or tamsulosin oral 400 micrograms once daily, or alfuzozin oral is 10 milligrams daily. Patients with bothersome symptoms and prostate size more than 40 milliliters has big prostate, we give finasteride 5 milligrams daily and terazozine oral 2 to 10 milligrams at night. You start with 2 milligrams at night and you double the dose at weekly intervals with a maximum of 10 milligrams. Or you can give tamsulosin oral 400 micrograms daily or alfuzozin oral 10 milligrams daily. So referral criteria: refer patients to who don't respond to pharmacological treatment or having complications like urine retention, hematuria, renal failure, and recurrent urinary tract infection to a urologist or surgical specialist.